Good afternoon, everyone. Welcome to our Strengthening Families webinar for September 2021. I really appreciate you joining us today. We are going to hear from a number of partners today about data-driven continuous quality improvement and hear about some really exciting ways that Mosaic and UC Santa Barbara have been thinking about mobilizing systems to improve child and family well-being. I apologize that my slides look a little wonky. I'm not able to put them into presentation mode today, so it's not for very many slides, so please bear with me, and we'll get to the presentation with slides that will look better than this. Okay, so just a little bit of context. We do these webinars each month. It's an open invitation to anyone who's using the Protective Factors Framework, coordinating Strengthening Families efforts, or just interested in strengthening families and protective factors. We convene these jointly between my organization, the Center for the Study of Social Policy, and the Children's Trust Fund Alliance. And each month we have a different topic, usually with guest speakers, and we coordinate those and welcome volunteers or suggestions. If you have work that you'd like to share, or if there's someone you think would be a great speaker on these webinars, please let me know. The Alliance maintains a Google site that has recordings and materials from all of these past webinars. It's been many years we've been doing this, so you can go dive deep into the archives there, or if you just miss a month and you want to catch up, you can always go to that site. You will get a follow-up email with that site link. There will also be a recording available on Zoom, so you can access this multiple ways if you want to share it with others later or review it, or like I said, if you miss a month and just want to catch up. Just a bit about what's coming up. We took a break over the summer, so in June we had a Strengthening Families State Leads meeting, and then in July and August we did not hold webinars, so it's been a little while, but we've got a packed and exciting schedule for the fall, so please put this on your calendar for the second Thursday of each month at 3 o'clock Eastern. On October 14th, our partners from Be Strong Families are going to share work they've been doing around the concept of vicarious resilience and what that looks like in practice. We will get the registration details out in a newsletter soon. You can also always check our website and that Alliance site for the registration details for the next webinar. And we've got great topics lined up for November, December, and January. So put them on your calendar and look for more details coming soon. All right, so for today, we are going to hear about data-driven CQI, and our presenters will be Prashant Rishvedja, Tony Hall, and Austin Ramsdell, all from Mosaic Network Incorporated, Natalie Jones from the University of California, Santa Barbara, and Pamela Federline, and I realized I didn't fill that in, but she is from Partnership for Children of Cumberland County, South North Carolina. Sorry to get that wrong. We'll have some brief updates at the end from the Children's Trust Fund Alliance and from CSSP. So with that, I am going to hand it over to Tony and Prashant to get us started. Tony, I believe you're on mute.
Hi, everyone. Thanks again. My name is Tony Hall with Mosaic Network, and I'm glad that you could join us today for our webinar on data-driven continuous quality improvement. I'll walk you through the agenda briefly, and then we'll dive right into the presentation. So if we could go to the next screen. We will start off with Kaylin and Prashant touching on Evaluation 2.0 and systems mobilization. We'll then transition to a conversation with Natalie Jones on integrated systems to sustain quality. I will touch base on a segment on data-driven insights and our work with Results Portal. We'll then hear from Austin about some examples from practice and improving well-being outcomes. And then we will transition to Pamela with systems perspective and improving community impact. So with that, I will transition to Prashant and we can get started. Or I'm sorry, to Kaylin and we can get started.
All right, thanks, Tony. So the team asked me to put this in a little bit of context as we get started, which is that when we look across the early care and education or early childhood landscape, there are existing investments and there are some increasing investments at this point in time. but we aren't always making the best use of them, and we have a lot of room to grow still as a field of early childhood. So over the last few years, we've gotten some really good insights on this from our partners at Build, if you want to show the next slide. And Prashant actually had saved these slides from a presentation that Debbie Mathias and Jerry Cobb did in 2018 about how QRIS, or quality rating and improvement systems, connect with professional development systems, how they align, how they support each other's goals, because those are two areas where we've done a lot of development in the field, but they haven't always been aligned. So if we move through these slides, they were asking some really good questions about how our theories of change intersect and whether we're moving towards quality and improving outcomes for everyone. We can advance again. Just really thinking about all the cross-sector influences on quality experiences for young children and on the outcomes for children, which are so much influenced not just by the early care and education setting, but by everything else going on for their families, by their healthcare, their neighborhoods, all the other systems that they interact with. And Build, like many of us, is always trying to promote an equity lens and an equity approach to this work. So really thinking about not just what's happening at any given center that might be serving a certain population, but what's happening across the entire system and within an entire community, whether we look at that at a town, a city, a county, a state, but what's happening for all the population groups and all the children and families within that area, and who's not being served well by our current systems. And some of our current ways of approaching evaluation can hide some of those important understandings about who's benefiting and who's not, and who needs some extra support or a different type of service or a different type of outreach so that they can access the service that is available. So these questions have been floating around for a long time, and we really need to think about them in some different ways. And I'm excited for Mosaic and UC Santa Barbara today to share some of the ways that they've been approaching this, because I think it's really promising. So we're thinking about policies that really ensure the well-being of all children, families, and professionals, because we care a lot about the providers in these early childhood systems. Thinking about funding and how we can, say we've got money coming from here and from here and from here, which all might be with different specific populations served or different types of services provided or different outcomes they're working toward. But what do they all have in common? What are they pushing toward, and how can we align those better? When we think about data, how can we actually build the capacity to use all this data that we're collecting? I think as a field, and this isn't just early childhood, but a lot of people fall into this, which is we're collecting a lot of data, we're reporting out a lot of data. That does not mean we're using it. It doesn't mean we're actually making decisions that are informed by that data. And we really need to think about quality improvement in a much more active way. It's not just which training did you go to, but more about what you've done in changing your practice. And then that last bullet point of learning, which is coaching professionals and parents alike to really be using everything that we know about early childhood, everything we know about family support, and using that to provide some evidence-based recommendations and support in all kinds of settings. So the project we're going to hear about today is really the projects we're going to hear about are really ways of rethinking some of these big questions in a way that is trying to make change across an entire system. So let's go to the next slide. I'm going to hand off to Prashant. We've been having some really good conversations about how all the data that's out there can actually be used to help address the childcare crisis that we're in, both to understand the childcare crisis and to address it. And I'm going to hand off to Prashant to take it from here to talk about all of this good work.
Thank you, Kaylin, and thank you everybody for joining us. The other day I had taken a screenshot of Jill Biden, and she was with some Hollywood actress, and it was a full page, some news site, and I saved it for myself to share with everybody, and it was like ECE goes mainstream. And as we're thinking about childcare concerns, crisis, whatever you want to call it, we all know what's going on actually internally, and we are all in the systems. but I'm like, wow, business news is talking about all the different aspects of it. How the corporations are being affected by it, how cost is affecting every demographic of the parent population, and most importantly, heart-wrenchingly, like how do we really reverse the trend of employment of mothers and women? So, as Kaylin had said, we have been looking at this very intently, and our partners from Cumberland County, North Carolina, are here, with for whom we've been collecting some of the country's best data on early childhood in the last 12 years. Actually, Obama White House gave a shout out to that several years ago. So one of the things that we are starting to do is that how quickly, in 2 weeks, 3 weeks, 4 weeks, can we do a longitudinal study based on past data, take some QRS information from DCD in North Carolina, from the state data system, and can we really sort of create a map of what the needs and gaps are, not just in terms of presence of a childcare facility, but beyond that, in terms of what is the efficacy of that could be. So this data analysis will be starting soon, and we will present, and our goal there is that we will be able to identify population, and we have been doing some preliminary analysis, so we feel fairly good about this, that we'll get good enough, we're not doing a scientific study, we're not doing a validation study. Can we get good enough insights from the trends, some of the from last 3, 4, 5, 10, 12 years of data, so we can really establish like what has childcare been like in the county. If we can do that, then the rest of the things that we have been working on for the last 3, 4 years our hypotheses will just seamlessly fit in, and without, as Kaylin has been talking about, without major shifts in policy, without without waiting for the systems change to happen, we can mobilize some of the resources now, and really sort of start reversing the trend. And what does reversing the trend mean? So in that sense, we are actually getting into some very we believe the solutions have been in front of our eyes for the longest time. We just never looked at it from that lens. So we have been working like incessantly for the last almost 3, 4 years in trying to sort of carry forward and think through and apply in practice the types of work that Kaylin cited from Bill and Jerry Cobb and Debbie Matthias. So we've been writing a lot of theories and policy papers, and actually doing a lot of data analysis and implementing some pretty amazing large-scale visionary projects out there across the domains and sectors. So in the coming months, we will be starting to write some of more position papers and white papers to see how everything is coming together. But for today, what we have, what little time we have, what I'm going to do is just assume that through a data analysis in any county or region, we can in fact identify to a decent level of granularity what the needs are and what the gaps are in terms of access as well as quality. So if we have that information, then what do we do? So with that as a context, and again, we'll get back to this at the end of the presentation in our dialogues with Pamela and Kaylin. But if we could find some sort of heat need gap map, if you will, then what do we do? So then the way to look at it is, a way to orient to our approach, the simplest way to look at it is, can we reimagine ECE in terms of by rephrasing some of the questions we have asked? So for example, and these are the 4 key questions that we are trying to answer. And today we'll show you some spotlights on how we are going about doing it. So first is how to leverage current EC investments to enhance individual well-being. We're not talking about child outcomes. We're not talking about any particular assessment. We are saying, can we actually directly go look at individual well-being, and can we sort of short circuit systems, funding, policy to practice? And we're talking about practice all the way to parent level, to the professionals level, because as Kaylin had said, we do care a lot about all the hardworking folks in ECE, and we need to care about their well-being. So it's well-being all around, all the way from a child to a young mom and beyond. That's number one. Number two is how do we leverage current performance measures to enhance service access? Ever since the 90s, we believe that early childhood has sort of pretty much led the way in writing great scopes of work. You do not see that in a lot of other fields. We work in quite a lot of different fields. So, you know, we've gotten very diligent about how meticulously write our scopes of work and goal areas and so on and so forth. Now, the thing is, this culture that we have created among grantees, among partners, can we use this culture of always performance measures, quarterly reports to actually enhance it to actually see what service access looks like? And by the way, these are some of the things that we had learned, which we are now applying to, okay, let's see if we can find, if I touched it in the previous slide, if we can find the needs and gap related to child access. That's number two. The number three is, you know, we were all extremely excited about QRIS, and not were, are, because it fundamentally QRIS, you know, that's exactly the thing to do. Figure out your own leti or matrix in your particular region or state, and it's all about action planning, you know, make recommendations back. So now with that infrastructure that exists, what can we expand the horizons of program quality? What does program quality mean? What lessons have we learned from QRIS? Again, can we tie program quality to either access or well-being, at systems level access, at individual level well-being? And we believe it can be done. It can be done with the right data integration and such. And again, everything that we're talking about, our manifesto and our motto is very simple. Keep it simple, nothing complicated, leverage existing investments, and see if we can expand the definition of program quality. And then the last question is, how do you leverage all the professional development and quality improvement infrastructure we have created in terms of training our professionals out there in the field? What type of learning can we provide such that that we can truly create a long-term sustainable impact? And we are not talking about doing dashboards, and Pamela will talk more about it when we have a conversation with her, but we are really, dashboards are important, but we cannot expect a teacher, a parent, a counselor, let alone a site administrator to actually delve deeper into the data, even if you give them the prettiest dashboards, right? So please, I want to know, I'm not talking about dashboards for teachers or parents or counselors and caseworkers, but genuinely, like, how do we help them inform practices, and on a day-to-day basis, they can focus again on two things: access and well-being. And Austin will talk about some pretty revolutionary work we've been doing in the K-12 space in the last 6 years, and how we're sort of almost bringing in education reform there. So again, it may be childcare access that we're talking about. It may be burnout of the professionals in the field, or parents you're talking about. The point that we're trying to make is, and to repeat and reiterate, we strongly believe, and we'll be publishing studies on that in the coming months and next year, that all the right pieces exist in the systems. Yes, systems could use improvement and for further efficiency and to improve their impact, but all the right things already exist to mobilize the existing infrastructure, existing systems components to make big things happen, or at least cause a little dent in some of the bigger problems we've been facing with for the longest time. So with that as a context, you know, what are those pieces? And what we have found is basically, just like Kaylin was talking about, we built a lot of investments into the systems. We have identified 4 key things that if we can find any 1 or 2 of these in any system, we can sort of get the gears churning. You saw in the build slide that we quoted from several years ago, that how all the gears were moving in different directions, and then we had to look at it from equity lens. So these are what you're seeing in front of you are basically pretty much, if each of those gears, we reimagine them, these are the key components we can find. So let's look at them real quick. So basically, is there individual outcomes? Like, so we need to have something related to well-being. And so, so how can we leverage existing investments to have research-based data so that we can integrate individual assessments and service data to sustain impact, right? And I'm talking about community impact here. So research-based data using individual outcomes to promote community impact, and everything in 3 months, 6 months, 9 month cycles, not long. system performance. We have all the scopes of work that I spoke about in my previous slide. So can we really use it to do like a more new age of results-based accountability? The RBA goes back 20-25 years, but can we actually now repurpose it based on the scope of work and all the data that has been collected to promote access? And as I said, use insights from individual and community outcomes, the two things that you saw on the left, to really define what quality means, and almost have very targeted technical assistance and capacity building exercise for program administrators and staff, so that they can look at quality in addition to how they're looking at it from QRIS, but also from a newer lens of well-being and access and coordinated care. And then finally, this is where we actually, we believe we could sort of complete the circle, or at least we have some very, very promising results using well-being data from the K-12 world in the last 6 years from across the country and beyond, where basically can we use well-being data to expand provider capacity in terms of, can we engage parents and teachers more? Can we leverage teachers to teachers talking to each other more? And and that's where so evidence-based practices already exist, but now we can make evidence-based recommendations if we have good quality well-being data, where we can leverage individual assessments and service data to ensure well-being. So one key thing I would like to point out is like the similarity between the green side and the red side. Here we are saying integrate individual assessments and service data to sustain impact. It's like the macro systems level. Tony will talk about it when he talks about his presentation. But then we're also talking about using the same data to have individualized targeted supports for the individuals. We're starting with the child and the family, but what else can we do? We believe that if we can actually do this, then it is very well possible and we have been demonstrating it over and over in the last 4 or 5 years actually, that we can indeed use data and evaluation put together to promote equity and well-being, because individual outcomes can directly be tied to that system performance. It can be directly tied to increasing efficiency. And then right next to that system performance also is ensuring access, that we can tie to program quality, to inherent continuous quality improvement. And then and from provider capacity perspective, as we had discussed in the last slide, we can really engage parents and the frontline staff. And if we can do all of this and genuinely create a sustainable way of just running these small bits and pieces together, so each of these dots is representing sub parts of our system, then yes, systems change is important, and it will happen incrementally, but we can start seeing impact at both individually and community levels now, and then hopefully we can sustain it. So that's sort of the theory. I hope it may there's a lot of new information, a lot of new terminology here, so I apologize if it's an information overload. And as I said, we will be in the coming months, and so we'll be publishing more about this and showcasing more about what we're doing in other projects. But all in all, the core vision and philosophy where this is heading is, we're calling it Evaluation 2.0. We really have to look at a new way how we look at our systems, our services. And we see 4 key components here. Yes, we need data, and yes, we need technology, but really need to sort of get some rapid results rather than waiting months and years. And we should be able to use those data to insights to promote access. That's number one, and Tony will be talking about it next, subsequently in the presentation. And as I had said, so, and from evaluation perspective, can we sort of make evaluation a little more nimble? Can we make it a little more agile using common indicators? And so the evaluation cannot, in addition to giving evaluation reports, which are important, but also provide some actionable insights so that we can streamline the CQI. So again, action planning from the QRIS world, but a little more sort of targeted for each different entity at high level granularity, if you will. And then once those results are in, we're definitely embedding in the evaluation in practice to improve outcomes. And again, Austin will talk about this more. So, and once these things are done, as long as there are sustainable systems, we really need to engage community to amplify impact. We need to share results with them. And again, in a very human term, so we can engage them. So that's sort of the overarching framework. And there's much depth to all of these things. So today, what we thought, just to give a sneak preview and primer of how we are doing it, we thought today we'll just share how we are actually doing it. So next, what you will see is Natalie will be talking about presenting her work on evaluation, like how we have repurposed logic model and such to really start measuring quality and performance and access. After that, then Tony will talk about, okay, how does Natalie's work results into understanding of what is, provide a context for the data that exists out there, and how that context could be used to generate more insights and present it to the community in something we're calling a results portal. Then Tony will talk about that, and then Austin will talk about, all right, if we have all of these results, how it could be used to actually inform, practice, and engaging parents. And then we will start conversations with Pamela and Kaylin and myself to see how these things are actually seen from a county local control perspective. How does it look from inside out to sustain community impact? And actually, just a quick note on that last one, we have also come to conclude and strongly believe that when it gets to regional and national and statewide initiatives, we really have to find the right balance of local control as well as statewide or region-wide sort of cohesion and or commonalities. Hidden in all of these things and underneath the very layers are like, how do you manage that? How do you have your cake and eat it too? But yes, local control is important, but we're not just saying local control for the sake of it. It's all based on the well-being data, the need for access and such. So on that note, I will now hand it over to Natalie, who will talk to us about how how her work can be templatized to create integrated systems to sustain quality. So over to you, Natalie.
Thank you, Prashant. So as Prashant was, talking about, as well as Kaylin, data without context can be really unproductive and kind of leave us, as was mentioned before, with lots of data, but with little direction or with little questions that have been answered. So today we really wanted to be able to discuss with you our process of connecting the system components. To do this, the idea is to build organizational, provider, and evaluation capacity. At the same time, strengthening stakeholders at various levels, as well as strengthening the system. So to do this, we've utilized the systems lens to make connections between organizational components and structures. If you could advance the slide for me, please, Prashant. Thank you. So as the initial part of this process, as you can see here, part of this is identifying the components within the system. And so, a lot of times we have a lot of data, we have a lot of different components within our system. So we wanted to provide this example that, for instance, identifying those components and being able to make those connections together. Could you, one more slide, please? Thank you so much. So with this, the idea is that we would be able to connect those spanned grantees, providers, partnering organizations, as well as countywide initiatives. As you can see, there's a lot of components here to be connected together. So as our first aspect of this is, thank you so much, is we wanted to utilize this mapping process to make clear the connections at the beginning from the organization's activities to the desired outcomes. So this is something where we start with perhaps a strategic plan or a plan for the program, whether that's been actualized and written down or whether it's still kind of in the drawing board process. And so then we're able to connect those activities and those results. And so if you could, thank you so much. But that's kind of a starting point, right? Is to make those connections about, what we're doing and where we want to go with that. But there's a lot more to that system, as you can see on here. So being able to make those connections between the providers, the activities, the results, the data, the initiatives that are going on within the system, we're utilizing a mapping process. So if you could go to the next slide for me, please. Thank you so much. So within that process, we kind of take a layered approach. So putting down that first layer, connecting those results to the activities, then we're connecting those initiatives and then connecting the providers on top of that. So then this allows us with a great framework to go even further with that and to start looking at the data that's being collected from each of those providers in each of those steps. So what we can do from this is this allows us to engage organizations and various stakeholders to build their capacity to not only utilize their own data, but to see themselves in the larger data that's across the system. This same function also provides us the ability for other system stakeholders alike. And so the idea with this is that that people are able to understand their contribution, providers are able to understand their contribution. We're also able in this process to look and to see the alignment from the data to the providers to the initiatives all the way back through the mapping. So what we can kind of do here is, as Prashant mentioned before, a little bit of a gap analysis. Is the data that's being collected for each of these providers and at each of these sites, is this aligning with the different activities and the different results that the organization or the system is looking to achieve? And kind of bringing this all back together is this idea that what we're trying to do here is be able to create this more holistic picture and align these strategic activities, these strategic results to what's happening, to build that evaluation capacity and to paint the larger picture, as Prashant was mentioning before. So if you could go one more slide for me, please. So this allows us ultimately to bring all of these pieces together, mapping the system and its connections. So in turn, the idea is that we are supporting evaluation capacity building, helping to provide information that's useful for data-driven decision-making, as well as at multiple different structures. So bringing together that strategic plan, bringing together that functional logic model that's been created from the strategic plan, using those statements of work to really help us to see the larger picture and put all those puzzle pieces together, and then finally be able to re-engage it through an agency report that allows everyone to participate and see where they are in the system. So again, this is, as Prashant mentioned before, this allows us to give that greater context to the data and why data is so vitally important to this entire process. So now I'm going to pass it back to Prashant.
Thank you, Natalie. And I just want the slide to be there for a little bit, because this is how answers have been in front of us all along, and it's just a matter of bringing it together. So I hope every connections, through this, we have gone way beyond data dashboards, and actually these days we try to discourage it. Can everybody hear me? My computer is saying my connection is unstable. Hello?
You broke up for a minute, but we can hear you fine just now.
Thank you. So with that said, we have been sort of the preeminent data provider in the social impact sector in general, ECE, K-12, international aid, public health. We've done like a lot of statewide, countrywide, international, and of course, local county level work in the last 25 years. And so we've really seen in depth that how much data exists, and we're going to analyze this data, for example, in North Carolina, as I cited. But even when we were doing all those data systems, when we do look at all the data and reporting, these connections, these contexts become so important. And what we're seeing in front of us right now is the context on the left that the commissions and the boards, they can really understand at their level. What you're seeing on the right is tying those things to performance measures that, again, the commission, the board, anybody else, the program administrators, the initiative leads can actually then have conversations around the data at the aggregate level. So again, shared language, so basically strategic plan operationalized. And then if we have the right indicators and we have the right outcomes, and if we can create those outcomes based on existing data, then we can start enhancing these program reports, this agency reports, a strategic plan to be more outcome driven, to be more action oriented. So with that as a context, so we can go back to the data. One of the big missions that we have in this decade is to reduce the quantity of data that is collected, hopefully help the field to do that, and whatever is collected, simplify it and make it very much actionable. But at the end of the day, data is indeed needed, and we don't necessarily need to buy a new data system or build a new data system, because basis of what we already have, there's tremendous possibility of merging and integrating databases. And again, we have been doing this for the last 15, 20 years, and all that we've done in the last 3-4 years is basically standardized it and templatized it. And so what does that look like? Well, how do all the data coming together looks like? Mr. Tony Hall will talk about some of the work that we've been doing in this regard. So Tony, over to you.
Thanks a lot, Prashant, and also thanks to Natalie for giving some context about why the data is important and the connections to strategic planning and results and outcomes and activities. As Prashant mentioned, what I want to do is to talk a little bit about some of the work we've been doing around making sense of the data. I'm sure most people on the webinar have had the experience of being overwhelmed by data, but we think there is a method to bringing the data together in a way that can produce insights and inform the work you're doing. So the next slide, please. So we, as Prashant mentioned, have been doing work in various capacities for the past couple of decades. We have several observations and assumptions when we start a project. Usually that there's a wealth of data already available that can be put to good use. But as folks on the call may have the experience, the data that exists, even though there may be tons of data, don't always provide timely insights. And even though there's a wealth of data and it can be all over the place, there's no guaranteed path to quality improvement. Next slide, please. So our approach in general is what we call the lean CQI approach. And the graphics, I think, explain pretty well what we're are talking about. But it's basically start with what you have and amplify and grow the insights using the data over time. Next slide. And this slide presents just a little bit more detailed view of what we're talking about. So on the left, you see a project we've been working on in California involves pulling data from multiple data systems and sources. On the far right, the end goal of this is to produce a series of insights that different stakeholders can use and help inform their decision-making and work. And the process between those far left and far right is a set of data processing steps where we clean and merge data, and then developing some insights that are, again, consumable and useful by different stakeholder groups. Next slide, please. And this slide just presents a different view of the similar process, looking at very specific data systems on the far left, and I believe this is from one of our projects in North Carolina, and then making sense of that data and merging it in a way that, again, produces results on the far right. And we recognize along the way that we're going to be working with multiple data sources. The data is going to be coming in different formats. There are issues around standardizing the data and around the different needs of the different stakeholders, but all that is taken into account in terms of how we go through the process. Next slide. So just a few highlights. I know we have a lot to cover still, but the point of this is that the process involves collecting current and historical data from different data systems and sources. It involves merging those data into what we call a results portal. It could be data that support a range of types of analyses. And again, the real takeaway here is to start small and grow the data results portal or data mart over time. We also make use of data science and business intelligence tools so that the reporting process can yield insights that are, again, easily consumable. And next slide. And again, the end goal here is to produce a set of reports and results that are going to be useful for a range of stakeholders that will support learning and ongoing decision making. And it includes executive and management leadership. It would include program staff, fiscal staff, for example, as well as policymakers, and probably last and not least, parents in their decision making. One other point is that we intend to pull together data that can be used in a lot of different, sliced and diced in a lot of different ways. So, for example, it would also support program level performance management, as well as development and creation of population level, community level indicators. Next slide, please. And again, I think this graphic is from an example of a project that we worked in Louisiana, working with Head Starts across the state. It involved pulling individual level well-being data about children in Head Start, and producing a series of reports that helped inform decision-making by the parents there, by the educators at a classroom level, by managers and policymakers at both the county level and state level. And those data were made available in this results portal that you see here, and accessible by a range of different stakeholders. So with that, I will pass it back to Prashant and on.
Yeah, thank you, Tony. And again, I hope everybody sees the common theme, well-being, and we are very consciously not using the name, not using the child outcomes or child well-being, because we really talk about individual well-being. And we have extended the definition of well-being to, like family resiliency, and Kaylin will talk more about how we could be extending this to parent engagement data, and not just look at from the child well-being perspective as we did in Louisiana and several other projects, but from the parent perspective. We can do the same thing from equity lens and equity perspective. Kaylin and group are doing some amazing work, and we are also collaborating with them in some capacity on how do you actually measure the equity in a community, the protective factors in a community, etc. So some early work, but again, very promising signs. And then soon at the end you'll see we are seeking support so we can maybe do more of such work and move this mission forward. But the bottom line is basically, can we use a simple well-being measure for whatever outcome or whatever entity we are trying to target? And then if we can create a nice individualized custom local measure, which we have proven is easy to do, at least for the first round, start small before we go big. It could be used as a marker for every individual's complete well-being. It can help you track progress over time on an ongoing basis. You can do sort of a classic pre and post if needed. But most importantly, and on that I'll pass it on to Austin now, can this data actually provide recommendations such that can we send an email to a parent over summer with a very specific tip specific to their child's well-being, how a parent can help them. And so on that note, I'm happy to report that we did actually have started doing that in several places, and to introduce to you what that looks like, I'll pass it on to Austin. So Austin, it's all yours.
Yeah, thanks so much, Prashant. And yeah, I know we're a little pressed for time here, so I'll sort of quickly go through these slides and give everyone a bit of a flavor of how we've used a well-being measure to really inform practice level improvements and provide actionable insights to really streamline and scale CQI efforts and build capacity. So this measure that we use, this well-being indicator, actually has been very well researched and has been widely spread, administered across the world on 5 continents and over 15 countries. But over the last 4 or 5 years, we've really used it in the United States at a K-12 level. And I'll just preface and say that while much of this work has been done in the K-12 world, which does have the luxury of a decent structure, namely through MTSS, the multi-tiered system of support, and the PBS frameworks. And this has been well demonstrated in our work across the state of Delaware, as well as districts in California and across the nation. Although K-12 does have this nice structure to overlay a well-being measure into, we do see value in adapting this structure to the early care and education world. And just wanted to preface and say, the lens that we're going to be looking through is through the K-12 lens, but we do see the applicability to the ECE world as well. So let's take a look at some of the insights and actionable results that come out of this well-being measure. First, sort of starting with the individual. A lot of times this is in the form of a child or a student. And we can see that individual level results, we have taken a strength-based approach to this well-being measure. So we strongly believe that all individuals have a set of strengths and a set of areas to grow in. So these individual level reports really give a nice profile and targeted insights into where students and children are excelling, what their strengths are, and what areas they may need some extra support and can grow into. We also couple that not only just giving the data and the scores and where children are excelling and where they're struggling, but also as I mentioned, coupling that with some evidence-based recommendations and follow-up strategies. So here we can see some examples of how we've actually done a literature review to identify the best evidence-based activities for promoting some of these strength areas in students and children, and actually providing these as resources for students, teachers, and parents to actually actively work and strengthen these assets and skill sets. The other area, and this is actually one of the areas we've really innovated in recently, is with parent communiques. And this is where we've actually been able to enable parent engagement and empower parents with their own recommendations so they can work with their children. And another important note is this actually has been providing a common thread and language for parents and teachers to talk about their child's well-being and get that conversation started, which we know can sometimes be a difficult barrier to cross. And then as we sort of move up in the hierarchy, if you will, or sort of take a more elevated bird's eye view of the data, we can aggregate this well-being data and be able to provide site level administrators and site level folks with actionable data to make insights at a school or at an EC childcare site with this actionable information, and then really aggregate that data further to do trends analysis, not only at the site level, but also at the regional level. We can see areas where different sites are excelling and where different sites are struggling, and how we can sort of look at that data and identify strategies for taking a common route to improving quality everywhere. And then, of course, we get into our more sophisticated and comprehensive evaluation results, where we use this well-being indicator to do some pretty creative analysis across strength indicators and across the various measures in a more formal evaluation report for folks to interpret and be able to use this data to make actionable data-driven results. And then, lastly, we have all this aggregated data and we have all these fancy reports and charts, but we also really have found value in putting this data into results portal type websites. And this is something that Tony was speaking about earlier, but I just wanted to reiterate it here because this has been an extremely useful way to be able to communicate this data and these results back to the wider community. Instead of sort of keeping it under lock and key at a site or a regional level, really present this data to the larger community and make it known and available. So with that, I'll pass it back to Tony, and we can continue.
Yep, and I'm looking at the time. We have very little time left, and really want to hear. So thank you so much, Austin. Pamela, I hope we have been able to include you as a panelist. And can you hear me, Pamela?
Yeah, I'm here. And hi, everybody. It's nice to see you. A nice rainy day in North Carolina. Not unusual this time of year. So we have been a longstanding client with Mosaic and work with a product called GemSlate, which warehouses a significant amount of our data across our programs. We are one of the 75 partnerships that function as part of Smart Start, which is the early childhood to the birth to 5 community in North Carolina. And so we've been leaders in the country in terms of developing sort of the early childhood things that need to happen in the best benefits for children. And there are continuing to be things happening at the state level that we're really excited about, but they're also really slow about moving forward with things that we want to do in Cumberland County. And because we have this database, we have the opportunity to take this information, 10, 12 years worth of data, and start thinking about how to turn it on its side and look at it differently. That slicing and dicing philosophy, if you will, which is part of what I do here. I'm the Vice President of Planning and Evaluation. And I started some conversations with Prashant and his team a couple of years ago about wanting to do some things differently that included the integration of the disparate data systems that we have, and what can we do to make those things work better together so that we can tie a child who's receiving a service in one program to another program, because those things don't talk to each other in the current data system. And so we don't really see the connections. And the same is true of our providers. We have data on the providers, we have data on the sites, we're tracking changes in STAR. We know who's received training in various assessment tools to assist them with moving their STAR ratings. We do professional development with teachers. So we do this wide range of things in our programming. But that ability for us to, for example, look at the coaches that are providing the services, and then look at the people they're coaching, whether it is the site, teacher, and what are the specific outcomes that are happening. How do we know that a specific coach is making a specific impact by looking at that outcome over time? So what can we learn from that, and what could we use to help other coaches, for example, that we're learning from seeing that person's specific impact? So that's a very granular kind of example of some of the kinds of things we're hoping to look at. But with some of the data, for example, our information captures the total scores for QRIS, and it does not have the individual breakdown, but the state does. And so our goal is that we would be able to match some of these data pieces and these elements to be able to look at things more broadly and also more granularly, so that we can really give some true insight into where we need to direct some energy to support change. We also know we're in a very difficult time right now, because we have fewer childcare in some areas of our county. Well, we also have growth happening, but the growth is being sort of misappropriated, if you will, in terms of thinking about it, because people think it's growing, but they can't find enough teachers. And so when we look at the pipeline of people that are learning to be early educators, even starting with our high school college programs, those people that start out early don't necessarily stick with it. We have 12 years worth of data. We can track a teacher from one site to the next, to the next, to the next, and see what kind of training they got. So those are some of the kinds of things that Prashant and I are thinking about. How do we dig into some of this and picking our projects in terms of what we think about? And always at the back of all of this, and I had a conversation with them earlier today, that whether it's a teacher, whether it's a family, whether it's an individual child, there is a face and a name attached to every single data element we've got. And while at my level, I often work with the disaggregated information, today I've been asked to pull special stories and share that qualitative information back with the state. And I worked last year on a project separately from partnership with the Department of Social Services in another county. And we took a sample that turned out to be about 20% of the children in foster care in that particular county, and it allowed us to slice and dice their data in a lot of different ways. And I learned some things about children that I never wanted to learn in my life. And I knew the names because of their initials. And for each one of those kids, you could tell me their initial, and I could tell you what their experience was by looking at what judge took care of them, what all these different variables, and I could tell their stories. I could tell their stories with data. And in the end, I learned a few really important points. The tipping point for a child is when they've had more than 2 social workers. And the average African-American child had 3 to 4. And so the equity issue became a very real lens when you start seeing that kind of data as an example. And so my goal is to start looking for the tipping points in what we're doing. And across our programs, whether it is how well are we delivering services to children in a subsidy program, how well are we supporting our providers that are out there, what kind of movement and stars are we seeing in programs that are 3 and 2, and are we able to get them interested in moving up? Because there's costs associated with that, and what other kinds of support do they need to have? So that's sort of a very 50,000-foot view, if you will, of sort of what I'm thinking about some of the changes that we're going to be making with our system with Mosaic in the coming months.
Thank you so much, Pamela. There's a lot left unsaid here, but once we get the data, go back to what Austin's thing was, we're really trying to bring individual back. And someone in the chat room was asking, do we have any examples of statewide? This is all statewide in a way, but what we're saying is that's exactly the point. Let local control, but still we can maintain state and local. We really need to sort of create more sort of decentralized, but a little more connected systems rather than what we have right now, very centralized but siloed system. So more to discuss, and please reach out to us. But I will quickly want to give floor back to Kaylin, and Kaylin, please feel free to wrap this up any which way you like. But the key thing is we're doing some amazing work and have been for CSSP for the last 12 years. That goes way beyond, it's totally separate than everything else that you discussed thus far. And we're hoping, we can, there'll be interest in some of those work as well. So over to you, Kaylin.
Thanks, Prashant. I know we're short on time, so I'm not going to say as much as I was going to here, but I did just want to make sure that everyone's clear that Mosaic has been the host for the Strengthening Families Evaluation Portal, as Prashant said, for 12 years. And there are opportunities to do an approach like what they've been talking about in these other jurisdictions that would also pull in more about the Strengthening Families self-assessments that programs are doing, the protective factor surveys or PFS2s that are being given out to parents, more about those practices that are happening in programs that could then be added to the data to help us understand what's going on in the community. So there's a lot of opportunity there, and I hope we'll hear from some of you who are interested, and we'll keep staying in touch about it. I am going to wrap us up and get us into a few little updates from CSSP and the Children's Trust Fund Alliance that we always share on these webinars. I'm having a hard time advancing my slide. Here we go. So Martha's going to share a couple updates from the Alliance. I will give very brief updates from CSSP, and if you're able to stay on for a few more minutes, please do, but I know some of you probably have a next appointment at the hour. So Martha, if you'd like to share your updates from the Alliance.
Thank you, Kaylin. First of all, I just wanted to give you a quick update about upcoming training of trainers, virtual training of trainers. We have 2 left in 2021, and the first one, which will be in September, is filled. So the December 6th through 9th training is still open, and you should have a flyer in your chat that will give you a code where you can go and register if you're interested in that. And you can also contact me for additional information. So in the next slide, I'd just like to share with you a report that we have out on the Alliance Resiliency Project, which is a model for flexible funding to support families. It has been an incredible experience and journey that we have been on with this project. And we collected data weekly from participants in multiple ways during the Caring Conversation calls and through monthly reflective surveys. And the report shares how this model has impacted the lives of families served during the pandemic. I hope you will take some time to look at it. And the Parent Voice page has the full report and 3 wonderful video testimonials from parents who served as peer advisors during this time, and also parents who received both emotional and financial support during the project. So just take a look at that, and we're going to be sharing more about this along with the Alliance National Parent Partnership Council in November on this call. So there'll be more to come. Thank you, Kaylin.
Thanks, Martha. I'm going to share a few updates from CSSP, most of which you can find just by going to cssp.org. I'm highlighting some of the things that are at the top of that page anyway. So I'll just quickly say we released a revision to our early childhood system performance assessment toolkit, which is very relevant to all the topics that we've been talking about today. This includes 20 measures to help you describe, assess, and improve on the functioning of a local early childhood system. So really getting at what is it about a system that leads to better outcomes than just having good programs, and what can we look at of how our system is working and growing that we could do better. So we had an opportunity to revise it. We added a couple measures and updated some of the existing measures if you'd seen it before. So I encourage you to check that out. And I will skip over. I was going to say a little more about that, but also just wanted to highlight some of our other activities that are going on. Willis and Friends is a conversation that you can listen in on once a month. David Willis, who's a senior fellow at CSSP, who's leading our work around early relational health, each month talks with different partners in the field about how they are working in the world of early relational health. And so in a couple weeks, there will be a session on September 22nd talking about vital signs of early relational health and looking at the autonomic emotional connection. So if you're excited to learn more about what more recent science is telling us about that parent-child relationship and what emotional connection actually looks like physiologically, it's going to be a really good conversation. And we had a recent webinar about ensuring that families receive the child tax credit. I know that many of you work directly with families. You may have participated in a webinar in May that we did as the child tax credit was just rolling out. Now we're really focusing on how we reach families that aren't yet receiving it, who may not have needed to file taxes before, might not be required to file taxes, but now if they file, they can get the child tax credit refundable. And so please tune in. We've got lots of resources from the ABC Coalition, which is the Automatic Benefit for Children Coalition. And if you check out that recorded webinar or the materials on our website, you can learn how to support the families you work with and make sure that folks are getting that child tax credit. A couple other ones, a recent paper we put out about how the law that brought us temporary assistance for needy families excluded immigrant families and how that has institutionalized racism in our social support system. So I encourage you to check out that paper, particularly if you are supporting families that are low income or families that are immigrant families or include immigrant members, mixed status households. Lots of interesting and important information there about that history. Finally, just encourage you to check out our website and our socials to stay in touch. And thanks as always for joining us today, and many, many thanks to our presenters from Mosaic and UC Santa Barbara and Cumberland County, a great cast of characters that all got to share a little snippet of their work. Really great information. I know we could have talked for a lot longer, but I really appreciate you taking the time to bring it to this audience, and really appreciate all the work you're doing. So thank you very much. Have a great afternoon, everybody, and we will talk again in October. Thanks.